Well, a big bonus for married couples. We were checking out all these new studies, and there's one that says married couples have a 60% less chance of developing dementia. The researchers say lonely and depressed single people are 60% more likely to develop dementia than happily married couples.
Interesting information, John. And did you know November is National Alzheimer's Awareness Month? And this morning we're talking about sleep. A lot of research that supports a connection between fragmented sleep and Alzheimer's disease. Dr. Joseph Ojile is the director of the Clayton Sleep Institute here to talk about it this morning. Hello.
Good morning, Randy.
It seems like everything always comes back to sleep. Everything.
It is a third of our lives, so there's a lot of opportunity for that to happen.
What did some of this research reveal?
Well, there have been two really important developments as it relates to Alzheimer's. One is that we have seen some research that suggests that the cells that sort of clean up your brain by taking care of the old synapses, when your sleep's fragmented, they get overactive and may cause damage to people that are getting fragmented sleep, to those brains. Also, people who have fragmented sleep appear to lay down more protein, and it's a type of protein that contributes to Alzheimer's disease. So there is this possibility over time that fragmented and poor quality sleep will contribute to the development of Alzheimer's.
So is it safe to say that if we have a nice long REM sleep for our 6 to 8 hours, which is always recommended, uninterrupted, those things don't happen in our brain?
Well, it does appear that that's a helpful preventive thing to do for Alzheimer's disease.
Well, a lot of people, have trouble going to sleep. As you know, you hear it every day in your work. What about medication? Should that be a helper?
Well, as we look, especially with Alzheimer's this week, or this month, we should look at the things that make people sleep better. So steady bedtimes and wake times. In this population of folks, they have struggles with getting up at the wrong times. Their sleep and wake times get turned around. So you have the prevention side, and then what we're going to do for the patients we have today.
The maintenance side.
Exactly. And so we want to work with those folks. We can help make their lives a bit better. We're not going to be able to cure their Alzheimer's, but this can contribute to improved daytime function and improve function and reduce stress on the caregivers.
Yeah, that's what I was going to ask, because there's such a ripple effect when it comes to people. I mean, they're not trained to do this. It happens in their family, and boom, they're right in the middle of it. They need their sleep too.
That's exactly right. So we want to focus on some of the interventions we can have. So some of that is structure. Sometimes we use bright light. Occasionally we use medications, and then we also want to uncover if they have other anatomic issues. So if they have undiagnosed obstructive sleep apnea, if we sometimes are able to fix that, that will allow us to also intervene on the other behavioral issues more effectively.
It always comes back to sleep, doesn't it? We're learning how important it actually is. All right, thank you so much,
Dr.
Dr. Joseph Ojile, always informing us. We appreciate it. And if you want to learn more about the studies we talked about and the link possibly, we have a website for you at the ClaytonSleep.com. It's on our website as well as our Fox 2 News app. And we'll take a break and be right back.